Hey, there's great news out from the CDC last month. They reported that overdose deaths are down by 4%. And I want to go deep into why that is and what's going on. And then what I'm going to do is I'm going to talk about more over-the-counter medications that can actually save a life. This is Sick Health with Kevin Ban, MD. Our show helps you navigate our confusing healthcare system so you can take control of your own health. Okay, great. Let's get into it. But before we do, please subscribe below, like a video. That's the best way to support the show. Now, like I said, CDC last week made a huge announcement, and that is that in 2023, overdose deaths are down by 4%. Now, that's very important information, but there's a larger context to all of this. And so I thought if you guys are willing, and if I promise you won't have a seizure, I'm going to throw up a graph that we're quickly going to look at together. And what you'll see is that this graph, first of all, goes from January of 2015 until January of 2023. Okay, so it takes about a year for us to accumulate all of the data. So if you're wondering why we only have it through January of 2023, it's largely because the data takes some time to put together. And what we'll see here is that in January of 2015 until about January of 2018, we're on the rise and overdose deaths were climbing. And then you get to somewhere around January of 2018, and we begin to see a plateau. And that's likely because a lot of the interventions that I'll talk about were starting to have an impact. But then in January of 2020, we begin to see that overdose deaths are on the rise again. Why? Because of the pandemic, okay? There was more isolation, subsequently more loneliness, and not only people weren't able to get to their doctors, and so we saw less treatment, and we got up over 100,000 deaths per year. And unfortunately, that's still where we are, but we seem now to have plateaued and we're starting to decline. Now, there are a series of reasons why that is. And I usually bucket those into really three major reasons. Well, the first is because of better treatment. And we see more treatment. So we have seen more clinical practices made available to people with opioid use disorder. And not only, we're beginning to see the use of virtual health, telehealth, call it what you will, but this is a great way to take care of people who have opioid use disorder. Let's face it, there is a lot of stigma attached to people who are suffering with addiction. And if they're able to be seen by a provider in the privacy of their home, it's a big deal. The next piece really are medications. And I think of three, and I'll go through each of them. The first is Narcan. The second is buprenorphine. Some people refer to it as Suboxone. I'll get there. And then the third is methadone, which you may have heard of. Let me start with Narcan. Narcan is a medication. It's called naloxone. And it is a medication that can actually save a person's life when they're in the middle of an overdose. So this is something that when I first saw it as a resident, I was amazed that a medication could be so effective. And that was an IV medication back then, but now it's become a nasal spray. And not only, it's a medication that you can buy over the counter. I'll get there. Okay. And what happens is, let's say you come across a person who is unconscious. Now, you don't know why that is. They could have had a heart attack. They might have had a stroke, but they could be experiencing an overdose. And so what you can do is administer this medication. You just squirt it into the person's nose, and that will immediately, if it's a drug overdose, if it's an opioid overdose, it'll immediately revive the person. Okay. Now, a lot of people say to me, yeah, but I don't know what's causing this person to be unconscious. And so I'm really reluctant to give them a medication. And I love that sentiment. It's actually deeply embedded in the Hippocratic Oath, which is first do no harm. Okay. But let me assure you, even if you give this medication to a person who is unconscious for a reason other than an overdose, they will be fine. You will not hurt the person. So it's kind of a no harm, no foul. Now, what I did was I actually went out and I bought some Narcan yesterday just to show you for today, how easy it can be. Now, I've been wanting to keep this in my truck, and now I'm going to put this in my truck. This medication costs over the counter about $45 with taxes, depending upon which state you're in, around $47, $48. Okay. And so you can buy this medication simply right now by going into a pharmacy. You'll find it over the counter. You don't need a prescription and you can buy it. Now, it's $45, so that's not cheap. There is a second way to buy this medication, and that is to go up to the pharmacist behind the desk and ask if they have the medication by what's called standing order. Now, not all states, but most states have a standing order. And that means that there's a physician or provider order for you to ask for the medication so that your insurance company will pay for it. Okay. So if you're like, hey, look, $45 is a lot, then try and you have healthcare insurance, then go ask the pharmacist. It's possible that your insurance will cover it, but you have to check because it varies. Okay. Now, this is something that I really believe everyone should have. One of the reasons why we're seeing a decrease in overdose deaths is precisely because this medication is more available. We see that police have it, firefighters have it, schools have it. I can tell you that when my son went to college last year, he just finished his first year in college, I gave him Narcan and I said, hey, listen, make sure that all your friends know that you have this medication. So if someone accidentally overdoses, you can save their life. So I really recommend that this be a part of all first aid kits. You should have it in your car. You should have it at home. The more places it is, the more likely you can save a life. Okay, so I talked about Narcan, really big deal. The second medication I want to talk about is a drug called buprenorphine. And buprenorphine is a medication that actually treats addiction. Now, what's interesting about it, and there's another term that some people use for it, it's Suboxone, okay? Suboxone is technically buprenorphine, and I'll explain what that is, along with naloxone, which is the Narcan medication. So Suboxone is actually a combination medication, but essentially does the same thing. Buprenorphine, Suboxone, is meant to treat people with opioid use disorder. Now, here's the interesting thing about buprenorphine. It is itself an opioid, okay? And that is very counterintuitive to people. So you sort of say, wait, hold on. I'm treating opioid use disorder with an opioid? And the answer is yes. Because what happens is buprenorphine is a medication that will block the pain receptors. And this will allow people to lead a normal life. They don't have withdrawal symptoms. They don't get cravings for an opioid medication. And so it's very important that this drug be made available to people. It used to be called medication-assisted treatment. Now it's just medication addiction treatment, okay? And it's very important to understand that. And I want to double tap on that for a second. In an earlier episode, when I talked about the Ozempic type drugs, I talked about obesity. And I said that, it's my take that we give a lot of lip service to a certain extent about obesity being a chronic disease. And oftentimes we think about it as just being a willpower problem. I mean, completely false. Well, I want to say that the same is true here of opioid use disorder. There are many people who will say that this is just a problem of willpower. This is completely untrue. When people take opioids, whether that's because they were using it recreationally or they were prescribed it for maybe having had surgery or a broken bone, there is an issue where when you take these medications, especially when you take too much of them, you change the brain, okay? And so this clearly is a disease. And like I've said before on the show, the best way to treat a disease, a chronic disease, is to come in and treat with the medication, and then you can work on lifestyle changes. But we should not be blocking people from getting this medication. It's very important that they get it. Then the third medication is methadone. Now, you may have heard of methadone, and methadone now is a very safe drug. It was very difficult to get methadone. You used to have to go to a daily clinic, and there was tons of stigma that was attached to using methadone. Okay. Now, what's happened is that regulations have been loosened to a certain extent so that people not only can take the medication home so that they don't have to go every day to a clinic, but you can also get this medication now more and more through virtual health, telehealth. And that's a really important step. So those are really the three medications I want you to know about. Now, the third piece as to why overall overdose deaths are down in 2023 is because we've made it easier for people to get medication. So I already talked about Narcan and the fact that you can buy it over the counter. But there's something else that happened, and that is that in order to prescribe buprenorphine or Suboxone, it used to be that you had to do extra training. It was called the X waiver. So you could prescribe a person opioids for pain or whatever indication, usually pain. But what would happen then is if you wanted to give them a medication, buprenorphine, that actually treated opioid use disorder, then you needed more training. Okay, that's right. So you actually needed to take an 8-hour course. You could do it online. It was called the X waiver so that you could prescribe buprenorphine or Suboxone, which is complete craziness that you could prescribe opioids for pain, but you couldn't to treat opioid use disorder. The feds got rid of that rule in 2022, and that was really important. You no longer need the X waiver, and that has made it more possible for physicians, whether they're emergency physicians who see this all the time, primary care doctors, or addiction specialists, to be able to prescribe this medication. Really important. Now, we've got some road to travel here. I talked about us still being above 100,000 deaths per year, and that's just too much. So what could we do to actually decrease the number of deaths? Well, the first thing is that we have to make clinical services more available to people. And so the federal government should mandate insurance companies across the country to pay for addiction therapy and treatment. It's very important. The next piece, we need to be doing more research. We need to come up with better clinical solutions, but we also need to come up with even better medications. And so we need more federal money, more dollars put into research. The next piece, I mean, look, $45 for over-the-counter Narcan is just too much money. And so we need to make these medications cheaper. Now, of course, I worked at Walgreens. I was chief medical officer there. This is a group of people who are highly, highly mission driven. And even last year, we started working on an own brand version, a Walgreens brand version of Narcan that would essentially cost much less than the current $45. So that's something that really needs to happen. And then the last piece is that we need to stop the flow of fentanyl into the United States. It predominantly comes from China, but also from Mexico. And that's something I want to clear up right now, which is that a lot of people are still referring to this as heroin overdoses. These are no longer heroin overdoses. These are fentanyl overdoses. And I have another graph that I want to walk you through to sort of show you this. Again, don't freak out. This is really easy to follow. This is a graph that starts in 1999 and carries through all the way until 2019, okay? And I want to make it very clear to everyone that in 1999, when the opioid epidemic started, that was with medications that were being prescribed by providers, okay? And I remember that time in 1999. I was in my residency, and there was something called the fifth vital sign. So we had the traditional vital signs: heart rate, respiratory rate, blood pressure, temperature. And what happened somewhere in the late 1990s is that we went to something called the fifth vital sign: pain. And this put a lot of attention on physicians, providers prescribing pain medications. And what we see then, starting in 1999 until about 2010, is that you have this the overdose deaths coming as a result of pain medications prescribed by providers. But in 2010, that changes. And it it shifts over, it flops over to heroin in 2010. Why was that? Well, because quite honestly, it was very expensive to buy medications like Percocet, Vicodin on the black market. It was much cheaper to get heroin. And so we saw a rise in heroin in 2010. But already by 2013, we saw the synthetic opioids, fentanyl, come into the market, again, largely coming from China and from Mexico. And that's where we are today. So when we talk about overdose deaths, we are not talking about heroin. We're talking about fentanyl. And I thought that was really important for people to understand. Now, this got me thinking in general about over-the-counter medications when I was buying Narcan yesterday. And I started to think about what are other medications that could be potentially life-saving. And I'm going to come back and talk about those after the break. But first, a word from our sponsor. C2 Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2 Sense's goal is to use their patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or a headache, keep your eyes out for C2 Sense as they're developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com. Before the break, I was talking about the difference between fentanyl overdoses and heroin overdoses. But quite honestly, when I went out yesterday and I bought the Narcan, I actually started thinking about over-the-counter medications in general. And so there are two more things I want to talk about before we wrap the show today. And that is, number one, the treatment of allergic reactions and how you can use over-the-counter medications that could maybe even prove to be life-saving. And then number two, I want to talk about the treatment of pain with over-the-counter medications. So let's start with acute allergic reactions, okay? Now, the first thing is that if you have a very serious allergic reaction and you're having trouble breathing, you need to call 911. This is a medical emergency and you're going to need help. Now, if that person has an EpiPen of some type, it's epinephrine that is given to the person through an auto-injector, you've got to do that. Anytime you have signs of a person with difficulty breathing, if they're getting swelling in their mouth or tongue, this is a medical emergency and you need to take care of it. Oftentimes, a person has an allergic reaction and it's not as severe. What usually happens is you begin to develop a red rash. And that red rash is itchy and it's warm. That's because it's mediated by histamine. And histamine, when we have that floating around in our blood, in our system, is going to cause that red rash, the itchiness, right? You really feel that. And then oftentimes warmth. Now, most people know at that point that they should give an H1 blocker. You probably don't know it as an H1 blocker. Maybe you do. But they'll give Benadryl, right? And that's diphenhydramine. And that will block the H1 receptor. Now, here's the interesting thing. There are actually two receptors. There's the H1 receptor, and then there's the H2 receptor. So when you give a medication like diphenhydramine, Benadryl, you're blocking only one of the two receptors. So you should block the second receptor, the H2, and that can happen with medications that often treat gastroesophageal reflux disease, GERD. That's Tagamet, Zantac, Pepcid. Okay, so that is another medication you should keep at home so that if someone is having an allergic reaction, you give them the Benadryl, but you can also block the H2 receptor. Now you guys are becoming pros by taking Zantac, Pepcid, or Tagamet. Okay, and then again, that's a medication that you can buy over the counter in the pharmacy. Now, allergic reactions can be really serious. So what I'm recommending here is that you start treatment because the sooner you treat, the more likely you're going to have a better outcome, but you need to have a healthcare provider check this out. This isn't something you should be doing on your own. Okay. The second thing I started to think about with over-the-counter medications was the treatment of pain. Okay. And there are a couple of thoughts with that. What are the things that happen that we often don't think of them somehow as pain, even though they're painful. And the two that I thought of were sunburn and urinary tract infections. It's interesting to me how many people will, be out in the sun, don't have sunblock on, they get a first-degree burn, but they don't think to treat the pain. So let's talk about sunburn first. Well, here I recommend that you take a non-steroidal anti-inflammatory drug. Well, that's a really, really fancy term for ibuprofen, okay? Ibuprofen, that's the generic name. The trade names are Motrin and Advil. Okay, so everyone knows about Motrin and Advil, ibuprofen. Let me make that point first. If I were you, go ahead and buy ibuprofen. That is the generic formulation. It is the exact same medication and it's cheaper. Okay, I always buy ibuprofen. Why do we use ibuprofen? Well, because it's a non-steroidal anti-inflammatory drug. It decreases inflammation. So when you have sunburn, you have inflammation. That's what's causing the pain. So you want to not only treat the pain, which you can do with ibuprofen, but you also want to treat the inflammation, which causes the pain. So when you have a sunburn, use ibuprofen. Okay. The second disease that I thought of was urinary tract infection. Somehow we don't think to treat the pain. And there are medications that you can buy over the counter to treat the pain of a urinary tract infection, which is normally pretty annoying, right? There's a burning sensation. It hurts every time you pee. It's terrible. There's a medication called Azo. You can go with Pyridium. The bottom line is these medications are available at your pharmacy. And if you're not able to find them, go ahead and ask the pharmacist. Now, here's the important thing. Urinary tract infections are caused by bacteria. I did a short on this, okay? And you want to make sure that you're treating the urinary tract infection with antibiotics. And this is a mistake some people can make, is that they'll get the medication that gets rid of the pain, but they don't treat the cause, which is they need an antibiotic. So clearly they need to be seen by a healthcare provider. Now, if you delay a simple urinary tract infection, you're at risk of that infection becoming worse and going from your bladder, which is called an isolated cystitis, up into your kidneys. That's referred to as pyelonephritis, and you get awfully sick from that. So if you're going to treat the pain of a urinary tract infection, please be sure that you're treating the reason that you have the urinary tract infection with an antibiotic. Okay, now that makes me think about pain control in general. And all mothers, for the most part, know this, which is that you can alternate ibuprofen, which is a non-steroidal anti-inflammatory drug, with acetaminophen. That's Tylenol. Okay, and I wanted to talk a little bit about how that works and the best way to do it. Well, first of all, ibuprofen is a medication that's metabolized by your kidneys. Okay, it is an anti-inflammatory drug, but it's also a painkiller. All right, so oftentimes, if people are experiencing pain, you want to get rid of the inflammation causing the pain. You also want to treat the pain. So you start with ibuprofen, okay? Now, another medication that you can alternate is Tylenol or acetaminophen. It's a pain reducer. It's also very good at reducing fevers, but it's not a non-steroidal anti-inflammatory drug. Where non-steroidals are processed by the kidneys, the acetaminophen, Tylenol, is processed by your liver. So you're not stressing the same organ, okay? Now be careful if you have a kidney disease or liver disease, and especially for Tylenol, make sure that you don't take more than you should according to the label, okay? Because if you take too much Tylenol, you can do damage to your liver. But again, this is an approach that really works for people, that you're alternating ibuprofen and Tylenol, okay? And that, folks, wraps up the show for today. I hope you found it useful. Of course, at this point, we always go into sharing beauty, and I've got some good news for everyone. Today, it's actually Chev who's going to share beauty, but because she's not exactly camera ready, she'll do that, Chev, if you're ready, only through audio. So what do you have for us today?
Hi, everyone. So excited to share this with you. This is a music video dance film that's a stop motion dance film that I absolutely adore. It's from Oren Levy. Her Morning Elegance is the name of the song, and we'll share the link with you. But it just brings me so much joy. I watch it every year. It's just such a beautiful, delightful piece of art.
You know, Chev, when you sent it over to me and you said, hey, how's this for sharing beauty? Like immediately I just broke out into a big smile and I was like, this is perfect, right?
Awesome.
It's
Yeah, it makes me smile too.
It's exactly what it's meant to be. And that's our show for today. Thanks for being a part of our community. This show was produced by Batsheva Gez and me. I'll see you next time. This show's content represents my personal opinions. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.